Cindy's root canal had been quietly poisoning her bloodstream for 12 years, and every dentist who looked at the x-rays told her everything looks fine. Then a three-dimensional cone beam scan exposed what every flat x-ray had missed: an infection buried at the root tip, silently leaking bacteria into her bloodstream the entire time. And the bacteria were heading straight for her heart. Without that cone beam scan, Cindy could have had a heart attack, and no one would have traced it back to a tooth infection. She had no pain, no swelling, no warning signs at all. What happened to Cindy is happening right now to many people who have no idea. It could be happening to you. Hi, I'm Dr. Chuck Reinertsen, founder of the Dental Medical Convergence. Over the last 40 years of practicing dentistry, I've found pain-free dental infections hiding under root canals, crowns, and old fillings that nobody knew were there. These can all harbor harmful bacteria long after the original root canal was completed. Now, standard x-rays will miss most of them. And here's what happens next. There are over 700 species of bacteria living in your mouth right now. Most are healthy, and we need them. About 20 are harmful. When one of the bad bacteria is hiding inside an old root canal, it slips directly into your bloodstream and goes everywhere your blood goes: your heart, your brain, and all of your other organs. During surgery, heart surgeons have found dental bacteria living inside the arteries around the heart. Those bacteria got there through the bloodstream from a pain-free dental infection nobody knew was there. A 2019 review in Frontiers in Immunology confirmed exactly that. The mouth is the source, and the rest of your body is paying the price. What makes cardiologists in America worried is that these infections stay hidden. So why is this happening? You should know that 90% of dental infections have no pain, which should not surprise any of us. Neither does high blood pressure, diabetes, glaucoma, or the early stages of cancer. Lack of pain doesn't mean that you're infection-free and healthy. Now, the flat, two-dimensional x-rays your dentist takes once a year were never designed to find these infections. A cone beam scan can, because it gives three-dimensional view of that flat x-rays simply cannot. Now, how many fingers am I holding up? Looks like 2. Now how many? Hard to tell. All depends on the angle, doesn't it? When researchers in the Journal of Endodontics used cone beam imaging to look at teeth with old root canals, more than 1 in 5 showed an infection at the root tip. That's 20% of root canals that still had infection. Almost none of those patients had any symptoms. They had silent, harmful infections that caused or worsened many diseases. But here's the catch-22. Your cardiologist rarely asks you about your teeth. Your dentist rarely asks you about your heart. Neither one was trained to make that connection. So you have to. Now here's what you can do right now. If you have a root canal, call your dentist and ask for a cone beam scan. Then take the results to your physician. Let them both see the full picture. If your dentist doesn't have a cone beam scan, you can have it taken at another office and then sent to your dentist. But rather than wait until it's too late, you can start preventing the next infection today. Now, once a day, spend 8 to 10 minutes thoroughly cleaning your teeth with a soft toothbrush, interproximal brushes, a water flosser, and floss. Use disclosing tablets once a week to find any spots that you're missing. Your dentist sees you twice a year. The other 363 days are yours. Now that's not pressure, that's an opportunity and power. When we found Cindy's hidden infection, we carefully removed the failing tooth, cleaned the bone underneath, and let her body heal. Within a few months, blood tests showed the inflammation in her body came down. The fatigue she had written off as getting older eased up, and she had more energy. Her physician was surprised. Can a tooth infection cause inflammation? Absolutely. Her body was fighting the infection. Now, no dentist had seen it because the flat x-rays didn't show it. Nobody did anything wrong. The tools just weren't enough. Cindy got lucky. We found her infection. Most people never get that cone beam scan. If you want to understand more of the hidden connections between your mouth and your health, my book, Are Your Teeth Making You Sick?, is on Amazon. And if you or someone you love has seen their health improve after addressing a dental issue, Please share your story with us at stories@thedentalmedicalconvergence.org. Your personal stories will help people connect the dots between the mouth and the rest of the body, and you could very possibly help save someone's life. Now, if this changed the way you think about your teeth, please like, subscribe, and share. In the interest of your better dental and medical health, I'm Dr. Chuck Reinertsen. Thank you.